And joining me really to bring this conversation to light is the Permanent Secretary for the Ministry of Health, Dr. Diana Twini. Doctor, just to bring the viewers up to speed, what has been the contribution of the UK government to our health sector?
The UK government has been working with us for a long time, and they have been supporting us in different areas. They've been supporting us in maternal and child health. They've been supporting us in training. They've contributed to some skill development in the area of neonatology, emergency medicine, critical care, transplant medicine. If you remember the recent team that came from Manchester, they've been working with our teams to develop capacity of the nephrologists in kidney transplant. They have been also supporting us in area of family planning. You know that they are biggest contributor to the support that goes to UNFP in family planning. They have been really, I can't quantify right now, but I know that over time they have been supporting us in so many specific areas. And specifically today we are discussing on how we can continue to strengthen our collaboration. And this collaboration is looking at especially strengthening the workforce, that working to strengthen the collaboration within the diaspora, how we can strengthen that collaboration to take our people to UK and they have mutual recognition, so that when they are there, they are free to practice. But also when their teams come here, we have been allowing them, we've been giving them provisional licenses to practice, even to learn. We have a lot to learn from each other. They have their areas that they have excelled in and where we can learn from. And also we have the areas that we have excelled as a country where UK can learn from us. So we are really discussing on how we can strengthen the diaspora performance of our teams that go there, because when they go in a manner that is not well recognized as a country, they end up not being recognized as a fully qualified teams, and therefore they don't get commensurate pay. But if we work together as government of Uganda and the UK government to have that formalization of the policy, and also the terms, like to have some sort of agreement that can help our teams when they go to UK, they are able to be recognized, they are able to be allowed to practice the way it used to be many years ago.
Maybe, Doctor, as we gear towards the conclusion, this conversation really comes in at a time when there are conversations in the UK about their budget cuts in terms of health and all the others. How do we as a country really strengthen our systems before they all leave?
No, it is, the collaborations are still going to continue. I don't think that UK is going to stop collaborating with Uganda, because the partnership is deep. And even when the funding landscape changes, I know that the collaboration will continue, because we have mutual interests. We have many mutual interests that bind us together. In health in particular, I'm glad to say that although the landscape of funding is changing, but we are not talking about even just funding, because even government can sponsor our teams to go to UK and study. I'm glad to know that to note that actually Ministry and Government of Uganda specifically has been increasing resources in health. And if you remember, even yesterday when the President was talking in Kololo, he said that even next year the emphasis is going to focus on health. And so One of the strategies that really we want to see take root and we pay attention to is making sure that we bridge the skill gap, especially the specialized areas. Because now as a country we are seeing more aged population, non-communicable diseases are increasing, and therefore we must be able to position ourselves to deal with all these tertiary services that are required, especially by the aged population, and to deal with complications like organ transplant, like in heart diseases, like cancer therapy. So we have to build the skill, but we cannot do this alone.